Good afternoon. Thank you so much for joining us today. My name is Rebecca Andrade, and I'm the Educational Programs Manager here at the Kansas Health Institute. And I would like to welcome you to our first session of our Bring It Learning series. The Bring It series is made up of 5 one-hour educational sessions about health policy topics related to issues that may be considered by the Kansas legislature this session. These sessions are an opportunity for you to bring your lunch, your questions, and perspectives to these important topics. And so if this is one of your first times joining us, just a little bit about KHI, or the Kansas Health Institute. We are a nonprofit, nonpartisan educational organization based in Topeka. We were established in 1995 with a multi-year grant from the Kansas Health Foundation, and we are guided by the vision that Kansas will become the healthiest place to live through evidence-based and innovative strategies, policies, and practices. We work towards this vision by providing nonpartisan information, convening crucial conversations, and facilitating learning that leads to meaningful change. If you visit our website or stop by our building, you'll see that our work involves research, evaluation, technical assistance, and policy analysis, as well as podcasts, blogs, and gatherings like today's convening. And now it is my pleasure to introduce my colleague Shelby Rowell. Shelby is an analyst here at KHI, and she will be facilitating today's session.
Thank you so much for the warm welcome, Rebecca. So for today, if we could go to the next slide, we'll just go ahead and orient you all to our agenda. So we have a packed agenda today that I think is going to create a lot of meaningful discussion. First, we'll start with an introduction of the Kansas Rural Health Transformation Program, hearing from Matt Lara at KDHE. Then we will go into a Kansas Conversations, which is our version of a fireside chat, which will be between Matt and my colleague Sheena, to really get a better understanding of the Kansas Rural Health Transformation Program. Then we will go into an overview of Federal Office of Rural Health Policy awards in Kansas, followed by another Kansas conversation with a grantee within the state of Kansas that successfully received FORHP funding. And we will discuss with her how rural communities can build readiness for federal funding. And then finally, we will close. And we noted earlier today, we know there's a lot of people online joining today's conversation, and you all probably have a lot of questions. We may not get to all of those questions, but we will be making sure that we're trying to answer as many questions as possible. So before we get started with today's discussion, we want to hear from you. So you could be anywhere during your lunch break right now. What brings you to today's session? And you can go ahead and respond to that question in the chat. So wanting to learn more about how this funding can be applied, opportunities for funding, changes in rural health and new rural health grants, curiosity. So a lot of curiosity around rural health funding here in Kansas. So awesome. Thank you so much. Alrighty, so next we want to make you aware of a resource guide that we will be adding into the chat as soon as we kind of see some interaction trickle down there. But this will be your resource guide. You can follow along, take notes, and we've also included resources to a few KHI products within that resource guide. So feel free to use it. And if you have any questions, again, feel free to put those within the chat. So next, I want to acknowledge a few KHI staff members that contributed to the research and to the conversations we're having today. First, we have Wyatt Beckman, Senior Analyst and Portfolio Strategist, and Victoria Sirkova, an analyst as well. Both of these individuals worked on the Funding Rural Health Project, which we'll be discussing in more detail today. Next, we want to recognize these three individuals, Sheena Schmidt, Carrie Bruffett, and Winche Lin, for their contributions to today's discussion as subject matter experts. So before we get started into today's discussion, we want to provide a little bit of an overview or orientation to rural health funding. Looking first at the key players within rural health funding, we know that rural health initiatives are interwoven across agencies. It's very dynamic and complex. So to kind of demystify that, we're going to provide a quick overview of who are some of those key players. So first, we have HRSA, which is houses the Federal Office of Rural Health Policy. And the Office of Rural Health Policy really serves as that central hub for rural-focused research and grant programs. Next, we have the Centers for Disease Control and Prevention, the Office of Rural Health. This is a relatively new entity that strengthens rural public health through data, prevention, and initiatives. Next, we have CMS, and CMS has a few different programs associated with rural health. First is the one you've probably heard a lot about, the Office of Rural Health Transformation, which is the office that administers the Rural Health Transformation Program, and the Office of Minority Health. The Office of Minority Health also has a rural health focus within that group. And then finally, we do have a few other agencies highlighted that may not work directly within rural health specifically, but a lot of their programming contributes to the overall health of rural communities. So next, we have a brief overview of how federal dollars get to rural communities. So we start at that congressional appropriation level. Once Congress has set the budgets for these different programs, that then goes down into federal agencies. And from there, those grants can be distributed to a variety of different grantees. Throughout our research, three of the most common pathways we saw was going to rural community organizations, state government, and state government could then, keep that for administrative purposes or to run programs, or send that out directly into community-based organizations, healthcare facilities, or even statewide organizations. And then on the other side of that, we also saw some instances of large organizations serving rural communities receiving those funds directly. So, going into our conversation, I would like to introduce our first speaker, Matt Lara. Matt Lara is Chief of Staff to the Secretary Janet Stanek of the Kansas Department of Health and Environment and serves as the Grant Program Director for the Rural Health Transformation Program. Since joining the agency in 2021, he has held multiple leadership roles and now oversees communications, legislative affairs, project management offices, and the statewide implementation of the Kansas's rural health transformation efforts. He brings a background in nonprofit marketing and communications and holds a master's degree in integrated marketing and communication from the University of Kansas and a bachelor's degree in business administration from Western Governors University. Welcome, Matt. We're glad to have you here today.
Thank you. All right, so we will just jump right in. Before we get started and to go into Kansas's plan, I want to level set about what the Rural Health Transformation Program, or RHTP, is. So this was a $50 billion program that was put into HR 1, or the One Big Beautiful Bill, last summer. The funds are really specific to transforming the rural healthcare delivery system and across all sectors, so hospitals, clinics, primary care, local health departments, all of those. The program lasts 5 years, with this being year one, and Kansas was awarded our almost $222 million for year one. This was the sixth largest award in the nation, which really spoke volumes to the quality of our application and the input we received from all the stakeholders. This dollar amount, though, is not guaranteed for Kansas every year. We have to provide updates to CMS regularly to show our progress and that we're meeting the milestones of the programs in the application we had submitted. So in August of this year will be our first report due to CMS for the work that's happened from January to July. And that's also when we will submit our budget for year two, and which will be awarded out later in October. So Kansas plan has 5 initiatives that we're working on over the next 5 years. The first is all about prevention and expanding primary and secondary prevention programs. Second is sustainable access to secure local access to primary care. Third, workforce development is build a sustainable rural health workforce. Fourth, innovative care to enable value-based care. And fifth is about technology and harnessing data and emerging technologies. Underneath each of these initiatives, there's multiple programs with different objectives to achieve all of those. These are just the broad 5 initiatives throughout the plan. We developed this plan in a record amount of time. I think we had about 40 or so days between when the NOFO came out and when we submitted our application. In that time, we received over 200 proposals and had dozens of stakeholder meetings to help get input on what Kansas needs in the rural community. And that's what we use to develop our application. We really focused on which programs or proposals had a transformative impact and which ones will be sustainable once the RHTB funds go away. This grant is different than some of the others. There's a lot of funding restrictions that CMS have put on this. And I'm not going to read through this entire list, but you can see here's 14 that we called out. I'll call out three specific ones that I think are important. This funding cannot be used for new construction, which I think a lot of people were hopeful it could be, as well as we cannot purchase food. I'll go into a little bit more detail about one of our programs, Food is Medicine, coming up, but we cannot purchase food with this money, with these funds. And then we cannot backfill programs that have lost funding, or we cannot duplicate funding. So if a program is already receiving federal funds in general, we cannot replace this with RHTP funds. This has to be new, something new that currently is not funded. If you go to the next slide. So we'll talk about how Kansas is implementing this plan. The governor designated KDHE as the lead agency, and so therefore we're the recipient of the grant dollars, and we're who CMS will work with on this plan. As we were developing it, the governor created the Kansas Rural Health Innovation Alliance. This group was used to help facilitate stakeholder engagement both in our application, but we'll continue working on this or working with them as we implement to get their input and their constituents and input as well. We are working with our partners at the CARE Collaborative with the University of Kansas Health System to implement this program. They have a lot of experience in the rural community with rural providers and connections that we can build off of to make sure this grant is successful. And the last point on this slide I'll really want to drive home is our implementation plan is all based off the plan that CMS approved. So we had to submit our application, and then they reviewed, and then we just had to submit a budget revision, which they're in the process of reviewing. So we have to stick to the application that's been approved by CMS or request them to approve something else. I won't read through all of these, but these are the members of the alliance group that the governor formed. Each of them represent rural health in a different way, and so we're excited to continue working with them throughout the implementation. So we have 6 priority programs that we're really trying to get off the ground as quickly as possible. One thing that if you hear me speak or our secretary speak about this is we keep saying it's all about speed to execution in this first year. The first year is shortened. We were awarded the money December 29th, and we have to have it obligated by October 30th. One thing I will call out is while the money has been awarded to Kansas, we have not been given an approval yet to spend any of the funds. And so that's one thing we're working with CMS to finalize and get approval on. So I'll walk through high level some of these priority programs that we're focusing on. The first is value-based incentive payment program. This plan is to provide quarterly payments to hospitals and clinics for employing evidence-based practices. Hospitals and clinics are typically already tracking a lot of the quality metrics, and so we want to put a system in place for them to do that appropriately, and then if they're meeting those metrics, we'll provide them incentive dollars. The second one is actually 2 different programs, and one that I probably get the most questions on right now. It's 2 grant programs that we will be administering out of KDHE. The first is the regional partnerships, and the second one is the REH Conversion and Transformative Capital Investment Grant Program. Regional Partnerships Grant has approximately $44 million dedicated for year 1, while the REH Conversion and Transformative Capital has about $15 million budgeted for year 1. We are right now finalizing those requests for applications and hope to get those released in the next couple of weeks. This will really be the first opportunity for organizations to submit requests to us to receive some of these RHTP funds. And so there's a lot of eagerness for us to get this out and turn it around as quickly as possible. The third program I alluded to a little bit ago is the Accountable Food as Medicine and Community Health Worker Deployment. The program is to promote healthy eating and exercise to prevent and manage chronic diseases. So we'll be working on getting CHWs into more clinics across the state and making sure they're trained in what food as medicine is, and can get to and help the rural communities that way. The fourth program is workforce development. I think there are a number of programs that fall under this, ranging from rural residency programs to K through 12 career exploration. We want to focus on critical shortage areas, including nursing and allied health. So I think this is why we're going to be working with the K through 12 career exploration, is we want to help some of those kids early, while they're young, look at what careers are open to them in the health area, so they can start thinking about that as they continue to learn. The fifth program is the interfacility transports. The idea behind this is we know that a lot of in the rural communities transporting patients between hospitals or for different facilities is difficult. And so we are looking at potentially setting up dedicated regional teams to be able to assist with transporting patients. And we think this will be really successful in helping them make those. And the final program I'll talk about right now is our Anchor Hospital Advancement Program. This one is, I think, going to be really critical for rural health. We know right now that some of the smaller rural hospitals transfer patients to Wichita or Kansas City or here in Topeka, and that's usually hours away from where they live and where their support systems are. And so this is bringing them closer connections and making sure that they have access to specialty services, all with the goal of keeping people closer to home. So we're excited for that one. So where we are now, this has a lot of detailed information on kind of what's happening, but I'll call out a few things. We submitted our budget revision to CMS last Friday. Sorry, that was not last Friday. That was 2 Fridays ago on January 30th. Those we are waiting on them to approve or give us feedback on, and so we're eager to do that. CMS has committed to getting responses back to states very quickly rather than following their normal 30-45 day timeline. So we're hopeful this week we will hear from them. We do have a pre-scheduled meeting with them already tomorrow, so we're hopeful we'll hear something at least tomorrow to get an update. We're working right now on a detailed implementation plan around those priority programs and timelines. This can include who we need to develop contracts with what RFAs, RFPs we're going to develop, all of those things. So while we're waiting on approval, we're continuing to work. So as soon as we have access to the funds, we can begin pushing the money out as quickly as possible. So this is a key deadline set by CMS with this grant. As you can see, it moves very quickly. We do not have those funds available to us. Like I said, we are waiting on CMS to approve. We're hopeful it's coming. But right now we are working on setting everything up. And then when we have those funds, we'll launch the programs as quickly as possible. We have our first reporting period is between now and July 31st. And that's really where we'll have to do a lot of the work to show CMS that we are following through on the application that we developed. August 30th is another important day. That's when our report is due to CMS, as well as we'll have to submit year 2 funding, with those funds being awarded on October 31st. For year one, we have to obligate all of our funds by October 30th of this year, and we'll have to expend all of those funds September 30th of 2027, or risk losing them. So as you can tell, this first year is very condensed, and so we're working very quickly to get the funds out as quickly as we can. And I believe that's my last slide, so I'll turn it back over to Sheena, and I will do my best to answer as many questions as we can.
Thanks so much, Matt. And I know there were some questions coming through in the chat, so I will kind of start off a little broad. Thanks for your presentation and for the great overview of the program. As you can see, it's complex, as everyone can see. So it's no small task. So thanks for walking us through the plan. Just to get us started, of everything that is included in the plan, what pieces do you think have the most potential to be transformative for rural Kansans? And then we can kind of transition into some other questions from the audience.
Yeah, I think it's a good question and hard to answer. One thing I think is really important about this grant is this is a grant that reflects what Kansas needs. It's not what CMS in Washington says rural health should be. And so we're very excited about that. I think there is going to be a lot of good things that come from our accountable food as medicine and CHW work, getting people more into the communities to help push those information out to there, as well as one thing I didn't cover in my slides, but there's a behavioral health integration aspect to this grant, which I think is going to be important, as well as different technologies to help hospitals reach more people and be able to provide care at a lower cost. And so we're excited to see all those come through.
Thank you. And there was a question that came in through the chat about how mental health, or is there a mental health component to this? Can you talk a little bit more about how behavioral health is included in the plan?
Yeah, so there is a number of ways that we're looking at doing this. We know that behavioral health people in a behavioral health crisis show up at emergency rooms and need assistance. And so we're working on transportation for those for when those happen to make sure they get transported to the right facility, as well as tele-behavioral health network will making sure that's expanded upon so services are more available for people across Kansas, but especially in the rural areas. I think those are the big two that one more actually. We're one of the programs is behavioral health integration within primary care, which I think is a huge program that I can't believe slipped my mind. But having access to behavioral health services through your primary care office, which is where most people get their care, is going to be crucial and really helpful to a lot of people who need this.
Thank you so much. Yes, that's really, I think, yeah, that's a big initiative that incorporates behavioral health. Thinking about, you mentioned transportation as a key component, and there was another question around how, transportation being listed as a primary need, and thinking about collaboration. There was a question that from a participant that says, how can we support this work with our existing network, whether it's through KDOT or mobility managers or public transportation providers? And then thinking of more broadly, as the plan moves more into implementation, which sounds like it's going to happen soon, how is collaboration starting to occur, whether it's for transportation or other areas of the plan? And are there any unlikely partnerships that you expect to form to move the work forward?
That's a good question. I'll answer the second part first, the collaboration that we're working on. So we are already working with partners and that provide EMS services as well as the health providers on kind of what the needs are. And so I think that is kind of exciting, as well as we're looking at what technology is out there to assist in doing transportations more seamlessly for for providers and facilities. So I we're not ready to announce all of the names of the people we're working with because we don't have contracts in place with for a lot of these. And so I think over time we'll be able to do that, and it's very exciting. I will say, right now, the opportunity to weigh in is a little bit slower while we're developing our implementation plan around this. However, I will, as we develop out who we're contracting with and what RFPs we're putting out, we'll put all of that stuff on our website so people can find more information on what opportunities are out there. But I'll also say if people have thoughts or ideas, they're welcome to send us an email at kdhe.rhtp@ks.gov. And we're happy to engage as we go through that process to make sure we're doing what's right for rural Kansas.
Thank you. We have a few questions, and please continue to put questions in the Q&A feature in Zoom or chat. Um, so thinking about one of the initiatives that involves food as medicine program, there's a question that says, you mentioned addressing the food as medicine program and the restriction of not being able to purchase food with this funding. How is that being handled, or what is included around food as medicine if those restrictions are in place?
So we're working with partners at K-State Extension Office on what this is, as well as some nonprofits like Hunger Free Kansas. We're also planning to meet with Department of Agriculture. They have some ideas around this. And so we're still trying to develop what the best way is. We have some questions out to CMS on what is allowed and not allowed. Because if we can incentivize a farmer to provide this food, then is that allowed? And so we're trying to figure out the best way to get the food component covered. So this is one of those things that we're still trying to work through as quickly as possible, and we don't have a definite answer for it yet.
Thank you so much. All right. Someone else has put a question in. They're interested in knowing how the Rural Health Transformation Plan in Kansas will be supporting local public health infrastructure and population health. So you can talk about the initiatives that kind of support that framing.
Yeah, so I think local public health and population health are fall throughout many of these initiatives. Um, and so we're looking, like I said, primary care is important, but we also know that a lot of people go to local health departments for some of the care that we may receive at primary care. And so we're working with them, and it called the Kansas Association of Local Health Departments as one of our members of the alliance. And so we are eager to get their input as we continue to develop this plan, to make sure that we are including them as we go through. I think there will be lots of opportunities for them to jump in, rather if it is the behavioral health services and getting more access to substance use disorder resources, or some of those things. Mobile cancer screenings will be working with those clinics as well as local health departments to make sure that everything is available in the rural areas.
Thank you. There were a couple questions that have come in kind of inquiring about how technology or the use of technology is incorporated in the plan. And I know you said that's something that you're really excited about, using that opportunity. Can you explain more about the technology components that are included in the initiatives in the plan and what the plan is for that?
Yeah, so in Initiative 5, it's all about technology. And so one of the programs underneath that is remote patient monitoring. And so the idea with that is we will work on setting up with a vendor to provide remote patient monitoring to some of the smaller rural communities. Right now, the people who are doing the monitoring in the hospital are the nurses usually. And so they're away from the bedside, they're monitoring patients. And so we're hopeful that doing this will help put more nurses and providers back at the bedside, which will open up more beds and services for the community. We're also looking at credentialing, which is has a component to technology, and centralizing credentialing for providers in the state, so they're not having to credential with multiple people, and it kind of streamlines that and gets them access a little bit quicker.
Thank you. And I know many other questions are coming in, some detailed questions. We will go ahead and share those with you after today's event and follow up with our participants for those. But just to close, um, just having kind of to wrap up the conversation, a closing question, looking ahead, as the plan is implemented over the next 5 years, in an ideal world, what looks different for rural communities, providers, or Kansans? What the state what do people want to see that's different using this opportunity to shuttle funding into rural communities in Kansas?
Yeah, I think this grant opportunity is really exciting for Kansas, and it will it's really ours to lose. But ideally in 5 years, rural Kansans will feel confident in the healthcare delivery system that's in their area. For patients, that will be fewer long drives, better access to emergency and primary care, and smoother coordination across the services that they're receiving. On the provider side, it will hopefully mean more financial stability, reduce burnout. The care model will be about fitting the size and needs of their community, which is exciting. And for hospitals and clinics, they're going to be stronger and be able to support the health outcomes in local economies. So I think there's a lot of goals that we're trying to achieve in 5 years. It's a very big plan, but I think in 5 years, rural health in Kansas is going to look very different.
Thank you so much, Matt. And thinking about, what's on everyone's mind who's participating and interested in the program and keeping up with it, how can rural communities and Kansans in general and partners stay engaged to help shape what comes next or stay updated on the progress of the plan?
Yeah, so we put everything on our website. And so at kdhe.ks.gov/RHTP, that is our website. And that's where you can find the full application, all of our alliance meetings, as well as some more information. And so I think that's probably the fastest way to figure out what's happening at the moment. Like I said, the email I said a little bit ago, you're always welcome to reach out. We are getting a lot of emails, and so if you don't get a response right away, I promise you we are reading it. It just takes a while for us to get through them all. And if anyone has ideas, they're welcome to reach out to me or anyone on the Alliance that they have connections with, and share those thoughts with them, and then they'll bring them back to us as well.
Thank you so much. And we really appreciate your participation and all of the great information you shared today. We will follow up with any remaining unanswered questions and hope you have a great rest of your day. Now I'll turn it back over to my colleague Shelby for the next part of our session.
Thank you so much, Sheena. So for the rest of today's programming, we're going to be talking a little bit more about Federal Office of Rural Health Policy awards in Kansas. So first, just to orient us to what FORHP is, FORHP is a office under the HRSA, or Health Resources Services Administration. FORHP contributes to rural health initiatives and activities in a variety of different ways, including coordinating rural health activities within HHS, administering a variety of programs to support rural health care, conducting and supporting various types of policy analysis and research, and supporting state offices of rural health. Our state office of rural health within Kansas is located under KDHE. So next, looking at our recent publication series, KHI has produced a series of briefs and grant spotlights called Funding Rural Health that examines the role of the Federal Office of Rural Health Policy that they play in supporting rural communities in Kansas and across the United States, specifically looking at grants between the period of 2019 to 2023. So within our analysis, What we mean by award when we say award is one award goes to one grant to one grantee for 1 year. So I like to think about it as 111. If there are entities that receive several grants within the same year, then each of those awards is going to be counted individually. Similarly, if a organization received an award that is a multi-year grant, that award would be counted separately for each year. Next, one thing that we talk a lot about within the FORP briefs as well as the fact sheets is rurality. And we know there are several definitions of rural. For the purposes of today's conversation, we've used the FORP definition to categorize counties as being fully rural or not fully rural. In those fully rural counties, all census tracts are defined as rural by FORP, while not fully FORP rural counties have at least one census tract that is not defined as rural by FORP. All award recipients within our analysis, however, are expected to serve rural organizations or rural communities in some sort of way as part of their grant program. So next, you'll see a map of the Kansas counties by FORP rurality designation. You'll see there are 93 fully FORP rural counties and 12 not fully FORP rural counties within the state of Kansas. And those not fully FORP rural counties are really centralized around the Wichita metro area as well as the I-70 corridor from Kansas City to Manhattan. So as we're going through today's discussion, just be thinking about kind of the differences across the rurality landscape in Kansas. So as part of our analysis, what we did, we looked at all 4,088 grants across 75 programs that FORP administers from 2019 to 2023. And those grants totaled about 2.32 billion that went out to grantees across the country. So for this analysis, again, we did sort grants into different categories based upon their focus areas, based upon the information that we found in publicly accessible documents. So looking at documents like NOFOs, RFPs, and other areas. A few key data points that we thought stood out for our conversation today, both nationally and in Kansas, the largest number of awards was centralized around the healthcare access and service delivery area. For COVID-19, this was a big area, obviously, during the 2019 through 2023 time period. A large proportion of Kansas's funding went to the COVID-19 response. You'll see there that 49% of that funding during that time period went to COVID-19 grants. And then finally, within research and policy analysis, this was another area that Kansas had a lot of participation in. So while it only made up 6.7% of our number of awards, it did make up 18% of Kansas's funding, and the average award size was 2.6 million compared to the national average of 900,000. This can really be attributed to the types of grants that we received in Kansas, specifically looking at those going to the National Rural Health Association, KDHE, as well as other larger entities. So looking a little bit more specifically at FORP grants in Kansas, Kansas did receive 71.9 million in FORP funding during the time period, which ranked us seventh among states in total funding received. About 53 or 57.3% of awards went to fully FORP rural counties. You'll see that in the map on the left. And then within the amount of funding that went to fully FORP rural counties, only 14.4% of that funding went to fully FORP rural counties. So there was a large variance among states, and Kansas was on that lower side. On the left-hand side, again, you'll see the map of Kansas. For the purposes of this map, we did split it out by regions within the state of Kansas. You'll see that all regions are represented, but different not fully FORP rural counties did receive funding. So going into a little bit more detail about a specific grant program, looking at the Rural Communities Opioid Response Program, one of the focus areas that we looked at was substance use and behavioral health funding. So in Kansas, Kansas received 2.2% of funding for substance use and behavioral health compared to 29.1 for the US average. So that is a pretty large disparity between the two and kind of points to the opportunity in the future for Kansas to go after some of those funds. One note we want to make, there is upcoming opportunities for our core funding that is expected to come out soon. Giving a little bit more information about what our core is. Our core includes multiple separate grant programs with different focus areas, but all of them support treatment, prevention, and recovery for opioid and substance use disorders, and that funding is delivered through multi-sector rural consortiums. Within the state of Kansas, we do have a few grantees that received that funding for both planning and implementation. One of those organizations being Thrive Allen County, they received both our core planning and implementation grants. And we are very lucky today to get the chance to have a conversation with Lissa Regier from Thrive Allen County to talk to us a little bit more about how her organization was able to successfully get those funds. So Lissa Regier is the president and CEO of Thrive Allen County in Thrive, Kansas, where she leads efforts to strengthen quality of life, economic conditions, and health in rural Kansas. Since 2019, she has led efforts to secure more than 17 million in grants, expand access to transportation and health coverage, and oversee the administration of local Spark and ARPA funds. Through Thrive Kansas, she oversees the Kansas Cares, or Coordinating and Assisting Reliable Enrollment Services program, and advances rural-focused policy, capacity building, and advocacy at the local, state, and federal levels. So welcome, Lissa. We are so excited to have you here with us today. So, to start our conversation off, throughout today's discussion, we've talked about how federal funding is a major driver of rural health work, but also how challenging it can be for rural communities to pursue and manage those opportunities. So, specifically related to your experience with FORHP's Rural Community Opioid Response Program grants, can you tell us a little bit about what made Thrive Allen County field prepared to pursue that opportunity when it became available, in your experience implementing that grant?
Yeah, Shelby. So the first thing I would say is we started looking at this a number of years ago prior to me being CEO of Thrive. And our CEO at the time, David, was very aware that a lot of the conversation going on nationally was around the opioid funding that would start being dispersed into communities. So what we ended up doing was pulling together our entire community. And we had the first opioid summit. I believe it was in 2016. What we did is we asked anybody in the community who wanted to be involved in these conversations to join us. But we were also very tailored to it. So we ensured we had mental health there. We had the hospital. We had all of our clinics. We had EMS, the sheriff's department, all of our police departments. We had people who had experience and lost loved ones because of the opioid epidemic. And we had pharmacists, we had everybody there that we could put in that room. And we had conversations about what this has done to our community, what we see we need to do to move forward to address it if we had the funding to do so. And so through that first summit, we were able to partner. I'm very sure that on this first grant, we partnered with KU to assist us to write it. And so we were successful in getting the planning grant and being able to work with a coalition that we then created out of the people at the summit to then work on what we needed to do to plan for implementing all of the work that we wanted to see done. I will say too, and we'll be really clear, just because you get a planning grant doesn't mean you get the implementation grant. It doesn't matter how great you think your planning is. We have had this really odd cycle where we'll get a HRSA grant and then we won't for a year, and then we'll go back and we get it, and then we don't. And so we continue to have a lag a little bit, but we have had multiple HRSA grants now where we've been able to continue to do this work. But I think the thing that made us so successful on the front end of this particular HRSA grant, which was our first federal grant, um, was that opioid summit that we held because we weren't the ones with the information. The community had the information that we needed to understand in order to address the needs.
Awesome. Thank you so much for sharing that. I think
Yeah.
one thing that we've heard about in previous conversations is how do we really ensure that funding opportunities are aligned with community needs? So not just going after funding opportunities for the sake of doing that. So could you speak a little bit more, maybe broadly, about your
Yeah.
organization's approach to really making sure that those community needs and funding goals are aligned?
Yeah, so I always kind of laugh because I have my chief strategy and development officer, Jessica. Her role is to figure out how to bring the funding in so we can do the work. My role is to tell her, hello, we don't have the capacity, or in order to bring in that funding, you've got to bring on two other employees. So can that be put into the funding, and then can we sustain it afterwards? So there's a push pull between her position and mine. And the way that I gauge the push pull and whether or not we need to take that risk, especially if it's putting more on a team and really kind of hurting their capacity and overwhelming them, is our community conversations that we hold. So Thrive holds conversations in every town in Allen County throughout the year. And so we go in and we really talk with them about what they're seeing and what they see as needs and wants and barriers. We also have a group called RHI, which is the Rural Health Initiative, and it meets once a month. And that brings together all of our healthcare entities, our social service entities, safety net entities. And we come together, and that group exists to break down barriers. So over time, we've created things called the connectors, which is where people call one phone instead of having to be tossed around to a lot of different agencies. They call one number, and then that person could connect them into other things. And that actually created a new nonprofit out of it called Humanity House. We created our first ever um, transportation system that does non-emergent and public, it's safety net and public transportation. And now it's its own nonprofit. And so this group comes together, and so we listen to what they say. So that's our healthcare team, basically, our health and wellness. And then we've got the communities themselves. And so we base what we go after on those two, but also because you're not typically going to have the community conversation, someone necessarily bringing up, we need a recovery house, because maybe they don't want to be the one saying it. So that's when we also look at data. So for years, we've used the county health rankings data to really show where we are in certain areas, because the community is not always going to lift up the really awfulness that you can see in that data. So we look at that data and we look at what they're saying, and we try and meld the two when we can.
Awesome. Thank you so much for sharing. So,
Yeah.
one thing that we also talk about is readiness to apply. So, you've talked a
Mm.
lot about how your organization has been really successful in going for different grant opportunities. Over time, how have you built up that organizational capacity and readiness to pursue some of these large opportunities?
Yeah, so it's a really good question, and I definitely encourage anyone to go after funds that can really address hard, difficult systemic issues. We have a recovery house now that we never would have had without these funding opportunities. We've been able to work across the state with our CMS grant to help people get health insurance, Medicaid, and Medicare. So there are huge things that you can work on. What I would say is that there are a number of things to be aware of. One is a federal grant is a lot of work in the sense that the reporting is very different than if you're reporting to KHF, Sunflower, any of Patterson, any of our founders that were or funders that we're used to working with in Kansas. Two, there, I don't think we've had a government grant yet that's not what we call a spin down or a drawdown. So if you're getting this huge grant, you're so excited because you're like, oh my gosh, it's a $2 million grant for us to use across the state. Well, guess what? You've got to spend the money first, and then you've got to report how that money's been spent, and then it comes into you. So you have to be aware that that's what it's going to be. So when Thrive a few years ago, 2 years ago, got a $2.2 million grant per year over the next 5 years. I will say it's been cut by 90% now, but when we originally got it, we couldn't have done that 10 years ago. We weren't in the position to be able to do it. We had to have built ourselves up to a place to know we could spend the money and then get reimbursed for it. So that's something to think about. The capacity side is huge. Do you have the partners in place? Pretty much every federal grant we go after, except USDA, which is what we do for housing, is multi-county. We're not just looking at one county. We're looking at multi-county or the entire state. And so when we do that, we're also looking at who our partners are. We know who they are before we write the grant. We've got their commitment. They know what they're going to do. We're not springing something on them last minute and saying, we tricked you and you signed the paperwork. It is truly, this is what we need from you. Are you in or are you not? And some of it's stuff we can fund, and some of it's just partners you have to have for the collaboration piece on a coalition. And you can't necessarily fund people on your coalition. So understanding who you have in the room, also understanding that almost any funder really wants the collaboration side and they really want the most bang for their buck. So if you can work in a larger area, that's helpful. If you are a small community, because typically rural communities think we're disadvantaged because we don't have the same numbers that everybody else has. But if you can work as a collaboration with your counties around you, you've built up the number of people you can positively impact through that grant. So those are a few key things that I would throw out there to think about with capacity. I'd also say this: the grant writing for federal grants can be really difficult. It's very different than our typical Kansas funders that we're writing for. Don't be afraid to reach out to KU or K-State or others who can help you write these grants. That they're ready. They stand ready if they think that you are a good fit for that particular opportunity. You can also talk to funders and say, hey, I think that we are a great fit for this, but we don't have the capacity to write it, or we do because Thrive has, but we still want a partner who's done a lot of federal grant writing to make sure that we've got it right. And there are funders who will say, maybe there is a way we can help you with a grant writer to ensure this money comes into Kansas, because it's a huge win. Like 2.2 million from CMS coming in, that we had seven other subawardees, nonprofits that we funded under that. That was huge when we were able to do that. And we want that money to come into Kansas. I'm going to be very biased here and say I want as much money in our state as possible. And that way we can continue to address all of the issues we're seeing in rural that you guys very much highlighted while Matt was talking earlier.
Absolutely. So one thing that you mentioned within your remarks there was just how volatile the federal funding landscape has been, and we did receive
Yeah.
a question within our registration, specifically asking how Kansas organizations can help fill that gap left by changes at the federal level. So, as an organization who has been navigating this, how have you guys been approaching this very difficult issue?
I know you didn't mean that as a pun, but I really, maybe you did. I appreciated navigating because it was our navigator grant under CMS that got cut by 90%. And so for us, we were told last Valentine's Day that they were cutting that funding opportunity by 90%. And I started going out and talking to all of our funders who they could not fill that gap. There's no way that funders in Kansas can fill the gap that the federal cuts have created, but they can help. And so what's interesting is we started to come up with different models. So I got additional funders who are trying to help us fund for another year or two while we try and come up with models where we can create a system where we can make a little bit of money for those navigators who all of our navigators, for instance, are trained as community health workers. I've seen this be a huge topic. We think they are integral into healthcare in Kansas. And so they're all community health worker trained and certified. We try and get them SHIC certified so they can do Medicare as well. And so we try and give them every tool in the toolbox. So we are trying to find other ways to be creative outside of just funding. How can we think of different models to ensure that if a cut like that were to happen again, I wouldn't have to lay off team members and I wouldn't have to lay off other nonprofits that we were awarding funds to, that yes, there'd be a cut, but somehow we could sustain. And that's not a lot of detail, and I'm sorry about that. I don't have it to give yet, but we are working on something that's a model that we're excited about. But that's it. It's really this outside the box thinking. It's how do communities support what you see as needs in your community? But there's just no way. The cuts were so astronomical on the
Mhm.
funding side. Philanthropy can't step in at the level that the feds cut those budgets. And so we have to get creative. And if I know not one thing, if I only know one thing about rural communities, is that we are scrappy and we're creative and we can do it. It's just there's a bigger burden on us right now, I think, to really figure it out.
Absolutely. Well, I know today's conversation is really centered around innovation and
Yes.
creativity. So thank you again for joining us. We are so glad to have you here and, appreciate all of your insights. So with
Thank you. It
that,
was great to be here.
yes, absolutely. Thank you so much for coming. So with that, I'll go ahead and transition it over back to Rebecca to close us out.
Awesome. Thank you so much, Shelby. And yeah, thank you, Sheena and Shelby, for moderating today's discussion. And thank you to our wonderful guest speakers, Lisa and Matt, for joining us today to share your expertise and your experiences and perspectives. We would also love to hear from all of you who joined us today for this session. You'll see a link to a survey in the chat, and you can also scan this QR code with your phone. We have questions in this survey that will help shape the upcoming Bring It session. So we'd love to hear what you're curious about, what you'd like to know more about. And so I'll linger on this slide for a few more seconds. Again, that link is also in the chat. Okay, and then we would also like to ensure that you have access to all of the resources that were mentioned today, as well as contact information for our subject matter experts. So you'll find that resource guide in the chat. We encourage you to download it, share it with your networks and your organizations. And then next Tuesday, we do have our second session, Health Insurance Marketplace Changes in 2026. So we hope to see you next Tuesday at the same time. And as always, we encourage you to continue exploring our website for a lot of other publications, reports, and tools that can support your work. And thanks again for joining us for our first Bring It session, and we look forward to seeing you next Tuesday. Have a great day.